Last November in Thailand, Ryan Straschnitzki became the latest of about a dozen Canadians to try an emerging treatment for paralysis. Canadians have watched Ryan's recovery from traumatic spine injury and transformation to sledge hockey player.
Nobody trip. Yeah. Way better than having to go through the Zamboni.
Now he's training his paralyzed muscles to move again. For that, he's getting help from a stimulator implanted on his spine, boosting electrical impulses from his mid-torso down.
I feel like I could move a little more. I'm just trying to get more core function. Kind of help me in the sled, help with hip movement and movement and stuff like that. So when I breathe in, the core activates, but when I breathe out, it stops.
He had a Thai medical team in tow.
Yeah, like it's twisting my body to the right.
To the right or
Yeah.
to the left?
They're figuring out the right level of stimulation.
Too much?
We can try that.
Pinpointing each muscle, each movement. Ryan's father, Tom, watches his development.
But I think they're trying to increase the voltage to get the nerves going and his core going. It might be too low, so I think they're just upping it.
Back at the Bangkok hospital, intensive physiotherapy continues to strengthen muscles activated by the stimulator.
A mini squat. Can you do like mini squat? No? Doesn't?
No, I'm trying.
Spinal or epidural stimulation uses tiny electrodes implanted over the spinal cord below the injury. A small generator delivers impulses, boosting signals from the brain in the hopes of reestablishing the damaged connections between the brain and spinal cord.
I mean, I can feel the stimulation going throughout my body, and there's a certain technique that my body has to get used to move the muscles.
Just how much motor function Ryan will regain is not clear.
Good.
But his family still paid more than $100,000 for the procedure because of the promise they've seen in other paraplegics.
They've done over 100 operations, all successes, all different levels of injury. And this is being used in Canada anyway, but for nerve pain. So I don't know why they can't work together.
In North America and most of Europe, the device was licensed primarily for pain management decades ago, not for improving motor function.
In the spinal cord injury community, it's a very hot topic right now. Everybody's interested in it. Some people want to take part in it. Others think it's too early.
Back in Canada, unlike Ryan, Steve Crocheter was implanted with a stimulator for free in the US as part of a clinical trial. He was paralyzed 10 years ago in a motorcycle accident. Calgary researchers are following his progress.
I will turn it on.
With the touch of a button, he can move his legs again, something he hasn't done in a long time.
And you're actively trying to
Pull my legs up, yeah. After 9 years of not moving any of your muscles, any of your legs, you almost forget how to do it. So the idea was to kind of retrain your brain to focus on those muscles that you haven't used in so long to do those movements.
And the movement is from Steve's brain.
Right.
That's where it's starting from. It's not from the phone starting the
Okay, it's more like a conduit in a sense.
Yeah, it's reawakening some pathways to allow his brain to recontrol his legs.
It's kind of emotional right now just talking about it. I mean, it's a pretty powerful thing.
While the new leg movement seems like a breakthrough, there are other big changes Steve's experiencing, building muscles to perform functions most of us take for granted, the invisible disabilities of being paralyzed.
I feel like I have more energy. I feel better. I feel like of course, my body temperature control, all those things, having it on helps with that, right?
What are the other complications that people may not realize that you live with as a result of a spinal cord injury?
If you're sitting for too long in the same position and you do a small movement, your legs are going to want to kick out. Again, you can fall out of your wheelchair. I mean, you can hurt yourself quite a bit. Also, you lose control of your bowels and bladders. Major aspect. Blood pressure, going from laying down to sitting, you're very lightheaded, to the point where sometimes you can pass out.
Steve, like Ryan, had to balance risk and reward in getting the stimulator. From bowel control to blood pressure and even lung capacity, it's transforming quality of life and independence. But there's still lots of fine details about this technology to figure out.
We're measuring how much oxygen he is using during this exercise.
Dr. Andrei Krasikov is a leading spinal cord researcher in Vancouver, investigating the progress of implanted patients and their invisible symptoms.
I totally appreciate the excitement of my patients who underwent through this procedure, either through the clinical trials or they paid and went abroad. But one of the aspects, we medical community, we have to be ready. The next important aspect that we still need more data, can we, with the same device, activate specific target organs? How precisely this, it's a many questions has to be investigated before we will come to Health Canada, FDA, for approval of this technology for new indications.
Scientific investigation takes time, and Isaac Darrell says he didn't have time after his accident. The former oil patch worker went to Thailand in 2016 for surgery. He worried if he didn't, the complications of his injury would kill him.
I think I would have had a stroke eventually. I was having all the symptoms of nausea, blurry vision, sweating profusely, almost heart attack signs every 2 days when I'd go to the washroom. So it was horrible.
Okay. Alarmingly high rates of heart disease and stroke are common after spinal cord injuries. Now for Isaac, the simple act of going to the bathroom is almost simple again.
I don't even have to use my stimulator. I've activated enough muscle in my core to just be able to go.
Do we have a good sense of the risks involved with having these long-term inside patients?
We have very clear track records of side effects from implantation of pain stimulators. Typical any surgery is a possibility for infections, but actually incidence of infections quite low when it's done in appropriate hospital settings. Right now we're doing a very well-organized, approved clinical trials to document what are the potential benefits and potential side effects.
It's a small patient group though. So.
Correct. It's only on a small patient group so far.
Possible risks include infection, shock, burns, and nerve damage. And even if the risk is slight, Dr. Krasikov says stimulators are still not a cure for paralysis.
So if epidural stimulation is approved by Health Canada, is this something that you would get for yourself?
Absolutely.
At this spinal cord physio center in Newmarket, Ontario, Barry Monroe of the Canadian Spinal Cord Research Organization is optimistic approval for epidural stimulation is 3 to 5 years away.
People are desperate. People are dying with spinal cord injury. We don't really realize that there are a lot of people who don't survive long-term spinal cord injury, and they're suffering, and there's not enough there for them.
Barry has seen lots of promising research in his 3 decades in a wheelchair and lots of disappointment, so he urges caution.
What happens for Ryan might not happen for another individual. We like to say a spinal cord is like a fingerprint. There's no two the same. This is a great step. We're just not there yet.
Back in Calgary, Ryan's family is also optimistic his recovery will keep going.
Then the intensity is this right here.
His mother Michelle is discovering what's possible.
Right now, we're just going to try and focus on the right now, that he can have as much control over his body as possible. And being a 20-year-old guy, he wants to be as normal as possible and have, those experiences as a young man.
Is it still a bit high?
Ryan's physio continues with the stimulator.
I think going in with that mentality, you'll be able to push yourself and hopefully be the first one to actually walk on your own.
Ryan knows this is not a cure, and while he's still adjusting to life in a wheelchair, he's also gaining some independence.
Great. So Vik, I understand that people who are paraplegic have been getting these implants for some time with some pretty remarkable results in some cases. How far away are we with getting these devices approved in Canada?
Well, it's interesting. Makers of medical devices have often faced criticism for trying to rush products to market without enough clinical evidence or information about possible side effects or complications. But, in this case, we contacted all 3 makers of, or the 3 main makers of these devices, and they're not actually involved in the clinical trials. They're leaving it up to scientists and researchers who are doing this work independently capacity. So the companies are hanging back a bit and not saying much about it. But, you know, once we see some favorable results in these clinical trials, peer-reviewed, that kind of thing, I think you can expect that they will apply to Health Canada and the FDA to have these devices used for this purpose.
Okay, so walk us through it. Hypothetically, if it was approved tomorrow, how accessible would they be to Canadians?
Well, in Canada, in theory, you could then pay a surgeon to do it or to implant this device if you could find one. But, you know, for our public healthcare system to fund this, they would, it goes through this public agency, which will evaluate whether it's effective enough that it's worth the cost. And then, and only then, could it be paid for by provinces? But even then, we saw with Ryan, there was a whole team supporting him. We just don't have that capacity and expertise in Canada right now.
All right, Vik, thanks very much.
You're welcome.